Everyone's excited to have our fellows here. The entire clinic is going to be really working closely with the fellows and to see them as part of our family.
REI's fellows are going to gain most of the clinical experience here at the UW Health Fertility Clinic. We do our retrievals, we do our transfers here. We're also unique in that we do office hysteroscopy, operative hysteroscopy right here in the clinic setting. We have our own C-arm, and so we do all our own HSGs. So we have that all-round experience where for the vast majority of the patient's needs, we are able to accommodate them right here in this clinic space. The average day in the clinic for any physician would be procedures in the morning that includes egg retrievals, embryo transfers, interspersed with diagnostic hysteroscopies, uterine mapping, or embryo transfers. That'll be obstetric ultrasounds, as well as new patient visits and follow-up visits, all in the space of one morning.
So one of the nice things about our clinic here is that we have a reproductive urologist who sees patients in clinic, so fellows will work with our reproductive urologist. We also have a health psychologist who sees patients here, so fellows will get to rotate with her. As part of my multidisciplinary PCOS clinic, the fellows will get to work with our metabolic endocrinologist. We also have built-in rotations where fellows will work with pediatric endocrinology, medical endocrinology, as well as genetics.
All the major surgeries take place at their hospital. The fellows will have the opportunity to help or assist with not only hysteroscopy and laparoscopic surgeries, but also robot-assisted surgeries. We have not only same-sex couples using donor sperm services. We have a big fresh donor egg program. We also have frozen donor oocyte program. We also have a fairly busy gestational carrier program. On top of that, we have a big presence in oncofertility space. We also have the unique position of having our American Family Children's Hospital oncology services being aware of our services and where appropriate referring even pediatric age group children with cancers for fertility preservation purposes. We also have Dr. Cooney attending transgender clinic as a consultant. That's another unique experience and exposure that many fellowships will not be able to offer.
One of the things that I'm excited about is just really the broad exposure that fellows will have to all of the different components of reproductive endocrinology, the infertility piece, the reproductive endocrine, and the surgical piece. Fellows will have the opportunity while they're here to complete the surgery training certificate, which is a really sort of unique aspect as part of our program.
We do laparoscopic surgeries for complex endometriosis, and where indicated, robot-assisted management of the endometriosis. We routinely tackle very complex and big fibroids. In addition to that, we have mini laparotomy approaches where indicated, as well as laparotomy as well. The fellows will attend the national didactics for these fellows. They will have a case list, and at the end of their training, they will receive a certification from the ASRM, SRS, as a specially surgical scholar track trained physician.
One of the really exciting parts about RA in general is just how much there is advancing on a year-to-year basis. We plan to have frequent journal clubs and sort of group meetings together where we're reviewing all of the latest literature so that the fellows' education and really also our patient, sort of what we have to offer to patients is always constantly evolving to stay up to date.
We have numerous research opportunities that span really the whole spectrum of the types of research. So the fellows can work on basic science projects, they can work on translational projects, they can work on clinical projects, and all of those would be set up with experts in the field. The Department of OB/GYN has a basic and translational science division, that is the Division of Reproductive Sciences. And all of the PIs who work within the Reproductive Sciences division are potential PIs that the fellow could choose as a mentor for their projects.
We have industry-sponsored research as well as funded research clinically. We are taking part in multi-institutional research as well. We have 2 dedicated clinical trial coordinators. Because of the level of funding we are able to use or garner through our various research programs. So we have a very robust clinical trial program here.
Every fellow within the Department of OBGYN actually has access to a research fund. I think the support for research is incredible, and it's absolutely a core mission and dedication of the entire department that UW should be a leader in women's health research.
Madison is an incredibly cool city. I personally like all of the different outdoor activities that can be done.
This is one of the most livable cities in this country. And on top of that, I think no matter what kind of an environment that you want to have living in Madison, you can actually create and find a niche where it will allow you to live that. It has that combination of big city amenities and the ability to have fantastic culinary experience, excellent restaurants, really awesome cultural scene. And because of that, it's been really enriching to live here.
I think it's an incredibly supportive department. There's a lot of opportunities for collaboration. So all of the different sort of specialties within OBGYN as well as other specialties really work well together, both from a research standpoint and from a patient care standpoint. Our division itself is incredibly close-knit. We work really well to support each other, and we're really excited to bring a fellow into that team.
I know that the fellows who choose to come here will share in that culture and that experience, and that we are all here because we all believe that if whoever one of us succeeds, we all succeed, and that's the culture that drives how this department works.